I want to just go over some terms and discuss the different options that we have for recovery. Think back to the video about the recovery timeline. We're looking at 30, 60, 90 days. We're really trying to create a program that gets somebody through that time period. First term that I want you to know is detox, detoxification. There's standalone detox facilities. There's hospitals, 911 call, and then there are also detoxes that are affiliated with residential treatment centers. Detox is that first period of time. People always ask, how long is detox going to be? It really depends on how much, what the person's use pattern was prior to entering into the detox or residential treatment. Alcohol detox, you've seen on television, people shaking, tremors. It's a medical situation. Detox facilities are basically 24/7 nursing care, watching over the individual, making sure that they safely come down to zero drugs and alcohol in their system. Residential treatment, kind of the old term for that, which I still slip into an awful lot, is rehab. We're talking about kind of the 28-day, month-long residential programs. There's an awful lot of residential treatment centers out in the country. We see them advertised on television, super expensive ones to super bare bones, cheap ones. We choose the residential treatment program. I work with quite a few. I see their results. So I only recommend places that I've worked with quite a few times. We want to look at the cost. We want to create a plan that's hopefully covered by the insurance. Again, like I said, there's expensive ways to do this. There's probably very cheap ways to do this. So we want to create a plan that is affordable for the family. Intensive outpatient treatment, that's another term. IOP is the short version of that. Intensive outpatient treatment is typically a 6-week-long program, 3 to 4 sessions a week of group therapy or private one-on-one therapy. Some people can go right into an IOP program. They might be able to skip detox and residential. I assure you everybody wants to go into an IOP program because that's the sort of the least significant. They don't have to take time off work. They don't have to take time away from the family. If somebody is highly motivated, if we go to the stages of change, somebody's in that action phase, they know that they have to do this, IOP might be successful for them. We might have to detox them before they can go into IOP. Somebody can't go into IOP still using. They have to stop using and then enter into IOP. Sort of the most common place to put IOP is probably after residential treatment. Sober living, you're familiar with the old term, halfway house. Sober living is a community living situation. A big part of making our decision whether or not somebody needs residential treatment, sober living, is what's going on in the home. If the home life is chaotic, we probably can't, the person probably won't stand a chance of recovery in a chaotic environment. Chaos can come in many different ways. Kids crying, maybe it's just an unsafe house. It's a house that they're using at. We're looking at a lot of things around the person to determine whether or not we have to use residential treatment. Sometimes we have to use residential treatment to stabilize the spouse partner at home. Like if there's been so much chaos, sometimes the reason that we use residential treatment is because just the spouse at home needs that time. Sober living is kind of the same thing. If we put somebody in a 28-day residential program and we put them right back home and we think there's like a guaranteed chance of relapse, of returning to use, sober living is a better option for them. 2 months, 6 months, a year. I'm not sure how long we'd recommend sober living. Sober living is community. We talked in an earlier video. The opposite of addiction is connection. We're forcing them to have connection. We're forcing them to have some friends. In sober living, at nighttime, there's group meetings. The whole house is getting together for meetings. There's drug testing. The house is probably running around to the same outpatient, so there's a real community around that. And we know that they're going to stay sober. This is helping sort of force that person past that 60-day mark, 90-day mark that we talked about. And then 12-step meetings. If somebody's really pre-contemplative, a 12-step meeting is not going to be enough. And usually what we see is people aren't doing 12-step meetings at near enough intensity. You know, if we're talking about residential treatment, we're talking about 8 hours a day of therapy, 24/7 of programming. 1 or 2 12-step meetings is not near the intensity of that. If somebody is going to recover by just using 12-step meetings, they're going to be motivated. Like, they're not pre-contemplative. They're going to know that they have to go to quite a few meetings, and they're going to take the suggestions, probably 1 or 2 meetings a day if somebody is active in their addiction using just 12-step meetings. Therapy and coaching. Sometimes people can't do IOP. They don't have time for that. They don't like group sessions. They might want to hire private services. When I do coaching with clients, I often do that as in conjunction with therapy or 12-step meetings. When I coach somebody, I want them to commit to 30 days, 90 days. Coaching is pretty awesome because it's accountability. I've set up a schedule. I want the person to meet with me 9 a.m. every day. If they've got a meeting with me at 9 a.m., they're much less likely to drink the night before. So the accountability of coaching and the longevity of coaching can make that successful in conjunction with other things.